think we have to repeat because people weren't hearing us.
Okay, let's try this.
Welcome, one and all. Let me give a thumbs up if I can hear. Okay, there we go.
Okay.
So welcome once more, C Technology again. But we are here once more in the house here in South Edmonton. It's 12 degrees outside. Beautiful, nice, cool weather here in summer in the prairies.
You're not going to throw stones at the prairie.
Right, and I have in studio with me the one and only, the indomitable, the roaring lion,
Lord.
Latoya.
Oh my God, Eric, you don't need to join with this Sankey that everybody's singing, right? Thank you so much for spending your Sunday morning with us again. Yeah, my name is Latoya Reid, and I'm happy to be here in the studio this morning, co-hosting with the indomitable Eric Reid as well. We have quite a fantastic segment lined up this morning. My friend all the way from Saskatchewan is joining us, and his name is Kwaku Ayisi. Did I get it right, Kwaku?
Yes, you did, Latoya.
Kwaku, it's been many years. Welcome. I know we've talked on the phone, but it feels kind of surreal, although you're not here physically. But we'll take what we get.
Yeah, thanks, and good seeing you again, Eric. It's been so long.
Right, it's been a while. It's great to see you too, and you know you've been doing some amazing work, and so we're really excited to really dive into that conversation this morning.
Awesome. So, Kwaku, we're gonna get you to introduce yourself and give a big shout out to all the folks that you want to shout out there, and then we're gonna get into why you're so pivotal for our show this morning.
Okay, so my full name is Kwaku Ayisi. I am from Ghana. I have an undergraduate degree in economics from the University of Saskatchewan and 2 masters, one in business administration and one in public policy from the University of Regina. I'm currently doing my PhD in public policy as well from the University of Regina. And I currently work as a senior legislative privacy and contract analyst at the Ministry of Trade and Export Development at the government of Saskatchewan as well.
Oh, wow. Let's drop a horn for that one. Yep.
Kwaku, but that's not how we met, right? Like, we started from the grassroots.
Definitely.
Yes, that is correct. Yes, we worked together. I met Latoya at Rancherlo Society, one of the group home, child and family services group home organizations in Saskatchewan, and yeah, that's where we met many years ago.
Many years ago. Anybody you want to shout out, Kwaku?
Oh, I'm usually careful with this, so I don't leave anyone out.
You don't want you don't want the family to come after you later, eh? So you had a chance.
Exactly. So I just say my family and friends and everyone in my support group.
All right.
And that way I get to cover everybody.
Yeah.
And in that way you get to shout me out too. Right?
Exactly.
Because I know a celebrity.
we know Kwaku. We're on the celebrity list, right?
Yes, absolutely. Yes.
But for folks who are out there, although we are laughing and we're being being relaxed in the space, what Kwaku is going to be talking about today, or what we're here to discuss, is actually a very serious topic, right? And I'm not surprised. Like when you shared with me the news article, Kwaku, about your research and your findings and what inspired it, I was like, no shock. I'm not shocked there, because when I met you, what was pivotal is your heart, your caring heart. I remember one night I was sick at work and I called for you to relieve me. I don't remember what it was that happened to me, but I called. You were the night float.
The night float.
And I was on a night shift and I called you, or you called to check in on me. And when you called, I told you I wasn't well. I wasn't feeling well. And you drove all the way from where you were to give me a heating pad. And I think you made some tea for me or something, but you gave me a heating pad. And I used the heating pad and I called you probably the following day or something. And I said, hey, I have your heating pad. And you said, no, that's okay. You can keep it for the next time. You know what? I still have your heating pad. And whenever I use your heating pad or I share my heating pad, I say, this is my gift from Kwaku. So, Kwaku, I'm not surprised and I'm very proud because you know the work that I've done in Saskatchewan, especially at the university level, to get people to recognize how profoundly scholarly Black people are. And so the thing that you forgot to mention is that you also do a podcast highlighting academic accomplishments at the graduate level.
Kwaku, you're holding out on us. Kwaku, you're holding out on us.
He is. So when I watch the podcast and I listen to the number of kinfolks, cultural folks who are in scholarly research and what they're sharing, I was also profoundly inspired by what you do, because I remember when I approached the university and I asked them for certain deliverables, one of their response was, oh, it's because our people aren't qualified. And we know the stats with that already, but we're not going to get into that. We're going to jump right into you sharing with us your findings about the disproportionate ways in which Black women are impacted by
cancer screening.
The research that you did is in Saskatchewan, but the Canadian Cancer Society also confirmed that Black women are disproportionately impacted by an aggressive cancer here in Canada, which diminishes the ability for us to survive, right? And so can you give us more information on your research? What inspired the research? Why is it important for people to know about this research?
Yeah, it's a good thing that you actually broke all of those down, because I was about to say, let's hear what sparked this research first, because there must have been something that said, hey, we need to look into this. So what started that for you?
Good question. So a few years ago, I had a friend who got breast cancer and died from breast cancer long before she got to 40 years old. I believe she was around between 28 and 30 years old.
Wow.
And so since then, I have been trying to understand more about it, look more into what are some of the causes of breast cancer, what are some of the, if any, environmental factors or factors related to one's lineage or one's biology or physiology, trying to understand, but not necessarily through the lens of academic research, just basically trying to find out more on my own. And so when I got the opportunity to pick a topic for my PhD research, and my initial topic then didn't really go through, and so I thought long and hard about this one, and I started reading around it because I wanted to know whether it was just a one-off or whether this is more of a systemic issue or problem. And the more I read about Black women specifically as related to breast cancer screening, what I was reading and what I was finding was very alarming in terms of the differences between Black women and white women and other populations, both related to the proportion of Black women who are getting breast cancer, the proportion who are dying from breast cancer, and the proportion who are screening for breast cancer. And so they are all related in some way, shape, or form. And I'll get deeper into that. But for your initial question, Ulrich, that was my main motivation.
Wow. So first of all, my condolences to you and the relatives and those that, shared time, space, and energy with that young lady that passed away from cancer at such a young age. And I must say that, it's scary. It's scary just to think of the fact that, screening can help to save lives. And typically we go to the doctor, especially if we're pretty young in that age range. Because I remember I went to the doctor recently for a scare, and they told me you're not in the age range that we typically screen for, right? So it's scary to think that that young lady could have been alive today if they took her seriously when she actually went, right?
Yeah.
So I can definitely understand, and that's sad. And I'm happy that you've done this research, because now it sheds light on what we probably have known for a long time, that our biology is a little different, our experiences are a little different, and that also impacts the fact that, guess what? These diseases that they have timelines on may come a bit earlier for us.
Doesn't that highlight, though, the chronic issue in the healthcare system when you live in a Eurocentric world or a Eurocentric culture where research isn't done for us or about us? And so whenever, conclusions are drawn, it's never about the Black body. It's always about the white body where research is done. And so you're speaking about breast cancer awareness and screening, but this goes across the board for so many other issues.
Yes.
And so we thank you for the work that you're doing and the awareness that you're bringing to this problem. How is your research received? And has there been any policy change or recommendation for changes?
So let me preface that by saying it's still ongoing, and so I would say preliminary findings. I'm yet to do to go out there and do interviews.
Yeah.
And all of that. So preliminary, what I've found, it seems to be, particularly among Black communities, it seems to be a big eye opener for a lot of people, because there's quite a bit of information in there, even related to policy and how policy is affecting how focus is placed. So what I mean by that is, I don't know if you read this in the article that I shared, but after my interview with CBC, the Ministry of Health was asked about this, Ministry of Health here, and they did admit that when they are creating policies, healthcare policies, and programs, it is not common practice to consider disaggregated data based on race.
I saw that.
Yeah. Yeah, so what that means is that if you have a policy or a guideline that we're going to start the free breast cancer screening program from 50 years old, based on what? And if it has been historically based on the lived experiences of the majority who are white women, that means that there's a possibility to overlook the lived experiences and how this disease affects Black women when creating those policies and programs. And the literature has shown that many Black women are getting breast cancer lower than 40 years old.
Yeah.
For many years, it had been, particularly for Saskatchewan and even other provinces, the free breast cancer screening program has been from 50 years upwards. it is more recently that they are trying to phase it to 40.
To 45.
And even that is still not based on data from, it's aggregated data. So, and when you talk about aggregated data, looking at our proportion of Black people within the aggregate, you're not really looking at or zoning in or focusing on Black women.
Yeah.
And so that policy these policies will continuously be created from the point of view of predominantly white women. And you can even you can look at other healthcare indicators, like when you go do blood, and I'm not going to get deep into that because I don't really know much about it, but even when you look at, you go do blood tests, and you're supposed to have your hemoglobin or your whatever levels between one level and another level. Sometimes that is also not accurate for Black people. And so you can go do blood work, and then it may come back and say, oh, your iron level or your sugar level is good at this level or that level. But then have they really looked into what that means for Black people? Because they're usually creating those ranges based on the majority of the population, which are white women.
One size fits all mentality, right?
Exactly. But moving back to breast cancer specifically, there's an aggressive form called triple negative breast cancer, and that is affecting predominantly Black women more than other populations. Part of the reason being that by the time cancer cells are recognized in Black women, it's too late, which means that it has spread from the localized region into other parts of the body. And so it becomes more difficult to treat. Part of that could be attributed to, so on a systemic level, on an individual level, but then when the system and the policies around are not encouraging, particularly for Black women, it goes a long way to determining what the outcome of a Black woman would be when and if they are diagnosed with breast cancer.
I'm glad you interjected that, Kwaku, because I didn't like the slightness with which the article stated the response from the Ministry of Health. Because when the response is, oh, but if you suspect, you can go back to your doctor, it dismisses the chronic issue in healthcare and the frailty when it comes to people who have authority over your health. And so in our community, the big issue, and I always talk about this, and I always see the disparity. People are afraid to approach healthcare professionals to ask them anything. And if we want to broaden it, I've had Black women who have shared with me that when they went to their doctors to talk about their fears about fertility, they're met with stereotypes and myths and dismissal. Oh, Black people are very fertile. They don't have a problem to have kids. And so those dismissals are part of the learned helplessness that comes as well, and silence or women in feeling as though we can't approach our healthcare professionals. As it relates to even, I know that there are even Black women who have multiple doctors for multiple reasons. And so it shows how out of touch they are in recognizing that there are systemic issues and discrimination even within healthcare that makes it difficult for us to want to approach healthcare professionals to share a concern. Not to mention that there is a sign within the medical offices that says one or two problems at a time.
Yeah.
So how do you take a holistic approach to somebody's health concerns when you can't even go in to give a historical context or an overall picture of what is happening to you?
But not only that, but here's the thing. The minister's response really is just sending you back into a cycle. So, for example, saying go back to your healthcare professional. So you go back to the healthcare professional, but then what do? They run the same tests. And the same tests are looking for the same things. And it's going to come back with the same results. So this research that you have done, Kwaku, is really shedding light on the fact that there needs to be more done specific to this particular demographic.
Yes.
And if it's not specific to the demographic, we may be missing things. It's like pouring flour into a sieve, and it's always going to come out at the bottom, right? We're always going to be missing things. So that is pretty important. But for those people who are listening, you mentioned the triple C form of cancer. Can you shed some light on exactly what that is? How is it different from?
And we'll shed that light right after the break, because I think a break is coming up right now. I think Eric is having too much fun. Eric, you're having too much fun. I think you're doing that. Like, what? You think this is a dance hall?
They shouldn't give a big kid toys.
We're back with you, Kwaku, to respond to that question about what exactly is the triple C?
Yeah.
Trait of
Triple
cancer?
negative.
Yeah,
Triple negative. Thank you.
Okay, so it is.
You don't have to get all too technical. It's just for the people in Radio Land that are listening and wondering, okay, what's this triple negative?
Yeah.
It is a very aggressive form of breast cancer. So basically, the triple negative are negative for estrogen receptor, progesterone receptor, and human epidermal growth factor receptor. And so these are the three negatives that it's referring to.
Okay.
And so what literature is saying is that typically more Black women are getting this type of breast cancer, approximately twice the percentage. So about 21% of breast cancers in Black women are triple negative compared to 10% of white women. So that's basically double the proportion.
Is that tied to our diet?
No.
No? Okay.
No, it's not. It's not tied to a diet. With most cancers, including breast cancer, it's effective treatment and prevention of death is mainly tied to screening.
Yeah.
And I'm hoping that we'll get to some of the facilitators and barriers to breast cancer screening participation among Black women. But this type is not necessarily tied to a particular diet. No.
Okay. I have a question, and I'll share a perspective before. So, in the world of mental health, physical health is very tied to mental health. And Black women, especially in Canada, or across the world, are seen as strong Black women. That's a trope that is used to describe us. And I always say to women, Black women, when I'm talking to them, or women overall, if you think about weathering from a rock perspective, from any chemical perspective, right? Weathering, after a while, taking on a lot of stuff breaks stuff down. So if you're taking in a lot, the term that I've been using to talk about how the body responds to external stressors is weathering and erosion of the body. So as you speak, and I was reading an article the other day that spoke about the physical health tied to the mental health.
Yeah.
And the mental health releases a lot of the hormones that you've been speaking about. You know, when you talk about depression, when you talk about, we look for a hormonal balance as well. And so do you, in your research, and I know that it's in the very preliminary stages as well, I'm curious about how the taking in of stressors, the impact of stressors on the body in causing a lot of, throwing off the homeostasis of our systems, if that can also be a contributing factor.
That is a very good point, Latoya. I haven't read too much about correlation between mental state or stressors and the likelihood to get breast cancer yet, but it would definitely be something I would look into, because I do completely agree with the connection between one's physiology and one's mental state, or how stressors work. I know lots of people who've experienced it. I've experienced it myself. So I know exactly how that can correlate, but I would definitely be looking more into it to see if there are any correlations.
Please
Very
do.
good, very good.
Please do.
Because we have a lot of, also have a lot of comments here in the on Facebook, and one of the questions coming in here from Greg is that recently in media there were a number of stories talking about how products made for Black women contain high levels of cancer-causing agents.
Yes.
Now, in your research, did you come across any data around that issue, or are there studies being done on this topic? He's a bit curious about that.
Not yet, but I did hear about that news regarding the products. It might have more correlating relationships with other types of cancer. I don't know about breast cancer specifically, but I found it very disturbing, and I definitely will be looking more into that. But it's something that over the years, I've heard amongst different people, pay attention to what is in the chemicals that are being used, both for men and for women. Pay attention to like, this could potentially cause cancer, but then sometimes it is just brushed aside as, you gotta live, because most things could cause cancer, which I think sometimes affects Black people negatively, because we have to look into these things more, because sometimes these products are made using data from a dominant group, which are white women.
Yes.
And so if testing is done on mostly white women regarding whatever product it is, and they come up with their outcomes that, okay, this is safe to go through, how is it going to affect, or how may it affect Black women differently? And so I think it was a very big eye opener in terms of us being more vigilant.
Yes.
What we're using and what we are even allowing to come onto our markets, and a big part of that is also tied to policy, which is one of the main focuses through which I'm doing my research, and I'll talk about that a little bit later, because there's somebody that is, or a system or a set of policies or an institution that is allowing these products to come onto the market. And so anybody will get away with what they can get away with if they can. But it's up to the policymakers, it's up to those who are allowing these products and these companies to bring these products onto the market. Have they gone through the type of testing that is
rigorous?
Yes, that is rigorous, and that has taken into account all groups as much as possible.
Yes.
And not just using limited data based on a particular dominant group to come up with their products.
Kwaku, thank you for protecting us. I don't know if there's any other comment.
No, that was well, that was the main one that came up there. But okay, go ahead. You have a question.
I have a question. Kwaku, my research brain is going off. So I have several questions. One, demography as it relates to, are these the women, the data that you're finding, are they Canadian based only? What are the implications of women who are recent immigrants versus those who've been living in Canada long term? And I'm going to tell you why I'm asking that question as well. The reason I'm asking that question is because when we moved here to Canada, we realized that a lot of the brands of food that we eat or we see here is not the same from our home country in Jamaica. And
even if it's the same product, it's packaged separately for different destinations.
Yes. And we found out too that even for Latin America, the Caribbean, the food is packaged very differently. And I just read on the news as well, because for a long time, the dumping of waste material from North America was going to to Africa. and there were complaints about the environmental impact there in Africa on the people. And I'm not sure of the specific places that it was being dumped, but it was a big issue that people were complaining about. And then recently, I saw on the news where I think it's a few African countries, and I'm not sure if it's Kenya or if it's Burkina Faso, that have banned people taking their secondhand clothing to deliver to African countries, because the clothings, like the I don't want to call specific names, that people are saying are bad for the environment or have implications on one's health, are actually being brought to the continent and being dumped in certain countries. I think it was Tanzania as well that are banning this. So what you find is it a possibility that the long-term impact is what is being seen when people come here? Like a longitudinal study, probably.
Yeah, it is possible. And I'm glad that you mentioned, because part of how I've broken down my research questions includes the intersectionality of different groups of Black women. Because as you rightly said, the lived experiences of, there are different types of Black women, and sometimes we need to emphasize that, right? Not all Black women are the same.
Bop.
Right. And the lived experiences of Black women from, let's say, sub-Saharan Africa might be somewhat
Totally
different from the lived experiences of Black women from the Caribbean. Yes, we do have a lot of similarities and interests, but there are also some differences. And even with Black women that are born in Canada and Black women that immigrate here from different countries, there are also some differences in lived experiences, and that goes to speak to some of the different facilitators and barriers there are to breast cancer screening. So that's part of what I'm going to be looking into more more closely, as I go through with my research. But even the connection with different products, as you mentioned, Latoya, that for secondhand, and sometimes it's difficult to keep track of some of the exposures that we've had with different products and different things that could potentially make us more susceptible to different forms of cancer.
Yeah.
But when we start talking about them, when we start advocating for better accountability, it will help us to be more aware of what we're doing on an individual level, but also hopefully it will help those who are in decision-making seats to make better decisions based on not just the dominant population,
Definitely,
but based on other marginalized groups as well.
Definitely. It sounds like you had something else to say, because I just want to pull the conversation back to something else that you said a bit earlier, but I want you to finish your statement.
No, I was just going to get into some of the different barriers and facilities.
Oh, you're hitting the nail on the head. That's exactly where I was going, Kwaku. Because I was saying, sometimes these conversations, they go by so quickly. Time is on us, but I want to hear about the barriers.
Right. And so part of what I'm yet to find out is, whether certain barriers are more correlated to certain subgroups of Black women or not, as opposed to others. But generally speaking, some of the barriers, so fear is one of the big ones. So both fear of the mammography process itself, as to how is this going to feel like, what are going to be the repercussions, because some people also think that the mammography itself could potentially give you cancer. Yes, there are very, very minute doses of radiation when you're going through the mammography, but it's in no way, shape, or form serious enough to cause breast cancer. But those are some of the myths out there.
Right.
Because if one gets diagnosed with breast cancer, the radiation process that one has to go, the chemotherapy.
And we're going to a break. Kwaku, I'm sorry, we're going right in.
And we're back, Kwaku. So we had to go make some studio money, and so we're back. If you could just Continue with that answer along the
yeah.
myths, causing the barriers.
For sure. So I think I was talking about fear. So fear amongst certain communities and groups of Black women in terms of the mammography process itself, but also fear of having to hear that they have breast cancer.
Ooh,
Because
yes.
unfortunately, among many, in their minds, that correlates to a death sentence.
Yes.
And I have friends personally who, if I ever bring up the C word, cancer, they don't even want to have the conversation.
Wow.
That's true.
And there's also, it's also tied into the groups of Black people, both who I know personally and that I've read about in terms of religious barriers. And so basically the fact that God will not allow them to have breast cancer, and so they don't even want to hear about it, but by speaking about it, you're basically speaking it into your life. And so sometimes that can be a barrier to them actually going to test,
That
because
is
they don't even
true.
want to have the conversation
Yes.
with their healthcare providers, right? And so that can be the difference between catching it early and being able to get rid of it, as opposed to catching it when it's late and then it starts, because by the time, a lot of times when it starts to manifest physiologically, it's too late.
Yes.
And so some of the what is even recommended is to have self-tests, but sometimes, because of, comparatively to white women, the proportion of Black women who have dense breasts are more than
Thank you for validating that, Kwaku. Thank you. Thank you.
Yes. And so sometimes, even with a self-check to see, to try to feel for lumps or discoloration or all of that, still might not be found.
Yeah.
Right. And so that's why the mammography is recommended a lot of times. Yes, it does help for self-check, but it still might not be found because of. And so when that is put out there as, we're doing for all groups of people because we advise to do self-check, because you're not taking into consideration that a lot of Black women have dense breasts.
Very
It's not the
dense.
same as
Yeah.
the breasts of a lot of white women. And so, that also has to be looked into. But then we're also looking on a structural level or on an institutional level. Some of the barriers have to do with biases amongst healthcare providers.
Yes.
And not actually understanding the lived experiences of the Black women that come to see them or talk to them. And so understanding both from physicians and from the system,
from the systemic level
as well. And so, there are a lot of Black women who don't even trust their physicians. They don't trust that they have their best interests at heart. They go, or they make appointments, they go see their doctors, and it's almost that they want to rush them through the system. I'm not trying to paint the whole healthcare system as horrible, but it's been very horrible to a lot of Black women.
Yes.
Well, we need advocates like you, though, Kwaku, to be able to highlight these these barriers and the myths and the stereotypes, because as you spoke, I know that I've said in the past, my husband, I've always scared him. I said, you know what? If I'm diagnosed with cancer tomorrow, I'm giving up. I've said that in the past. However, the reality kicks in that my mother-in-law was diagnosed with cancer, although it wasn't breast cancer. It was a different form of cancer. And when I saw the decline in her, I had to run. We ran. The healthcare system failed her, and we had to look at different options. She's now in remission. She's fully recovered from what was deemed as a stage 4 cancer. And it was stage 4, but we fought. And she decided to fight along with us. And the outcome is remarkable, where she was even interviewed in the US for how, they were able to turn things around. But I'm glad that we're speaking on this topic, because it highlights the need for education, the need for destigmatization, the need for debunking myths, the need to meet people where they are, but also to gently encourage a change in perspective, right? Because the fears are real, the perceptions are real, but lots of times, again, the helplessness and having to deal with systems when you're going through a different kind of pain is different. Like my mother-in-law was sick for months, years, and she never did anything about it. But when family came in and we were able to meet and to support, so then it speaks about the communal and the village response to supporting a lot of our women in these diagnoses. But many of our women are here as immigrants, no family support, not many connections. And so we're isolated. And in being isolated, we have to work, we have to pay bills, we have to do all kinds of stuff. So sometimes our health isn't prioritized because survival is the priority for us. So you have spoken eloquently about so many pivotal variables and factors that are necessary for us to discuss in educating our folks out there. We have 3 minutes. And I don't know if Alaric has any follow-ups for you. But
I had one.
Yeah.
I know that 3 minutes may not be enough to cover this, but I know I know that you had mentioned a bit early. I know that your research is trying to affect policy, right? Which is where changes really get made. What can the community do to help you along this front? Right, because obviously it's important that community comes along to help. And is there funding to ensure that this continues and we see the fruits?
Right. I'm glad you mentioned funding, because that's one of the things I wanted to get into as well. So in Ontario, where the biggest concentration of Black people are, or the highest number of Black people in Canada are, they are sort of, or have implemented some programs in collaboration with NGOs and churches to promote the importance of breast cancer screening and educate people more about breast cancer and the screening. But a lot of times this ties into funding as well. And so part of what or some of the recommendations regarding funding is for the government to prioritize this. And so if the government prioritizes this and makes funding available, then some of these groups can access these funding to educate on a community-based level for different groups of women. Muslim women who go to mosques, or Christian women who go to churches. There are a whole variety of Black women. And so this is very important for education, because a lot of these programs, they cost money. But also, when I talk about policy, also related to the education or the training that physicians and healthcare providers have to go through, because some of them are not even aware of their own biases. And so for the government to fund training programs that will make healthcare providers more aware, like in terms of engaging with Black communities, right? Not brushing them off, understanding where they're coming from, their lived experiences, and also when it comes to marketing. So even when they are marketing breast cancer screening participation, are we always seeing a white woman on the poster? Because sometimes we are attracted to things that open to people and environments that look like us, so that we can see ourselves in. And so all of that is tied into policy. The policies that go into the marketing, policies that go into money or funding available, and the awareness and collaborations with decision makers to make policies, and even media outlets to be talking more about this, with researchers to be talking more about this, and also tying it into the community-based groups who can affect changes on a grassroots level.
Amazing.
Wonderful.
Amazing.
Wow, you did that right on time, Kwaku. Amazing. My friend, thank you for always staying in touch. You're probably one of the consistent folks over there that have, doesn't matter where I've gone, we still seem to find our ways to reconnect. I'm happy for the work that you're doing, and we hope that in bringing voice, media is very important for us to hear our stories, and that is also one of the main reasons that we are in this capacity on the radio show, because it's important that our stories are documented from our perspective, not his story, our story. And so, Kwaku, we are quite proud of the work that you're doing. We're happy to collaborate, we're happy to highlight, And we look forward to ways in which we can support and continue to do what you're doing, my friend. Thank you.
Amazing,
Thank you
amazing.
very much, Latoya and Ari, for having me.
For sure, for sure. I'm actually thinking now that there's so many other questions. We probably need to bring you back on here to talk about those. But we want to also say thank you to G, who has been Big G, who has been running the technology behind the scenes. For those of you who are watching on Facebook and seeing all of this, Big G's behind the scene pulling the strings to ensure that you can get a great visual of what's happening in this conversation. So let me drop the horn right there. And so as we wrap up right now, we have Miss Laura coming in next with the Latin R. We come back on the block this Friday with the next 48. G and Special K are back this Friday with the next 48. The weekend morning show on Saturday with G and Danny. And next week we actually are on a hiatus, so Big G will be taking over this segment for the next 3 weeks. We're actually off on vacation for the next 3 weeks, going to sunny Jamaica.
Yay. Call me, Jam Down, call me.
Yes, so again, Big G will be taking over this slot for the next 3 weeks, but we will be back and live and in living colors. But until then, we say peace out. Thank you for joining us this morning. Thank you for being here, Kwaku. And let's hear Sizzla continue to take us out.